Good morning once again, viewers at home and around the world. We're happy to be back this morning on Health Matter on WAP TV. And today, we have two very lovely looking ladies in the house. I'm honored to be sandwiched between two beautiful women. On my right, I have an associate professor from University of Lagos, Department of Preventive Dentistry, as well as periodontologist working with Luth. Dr. Mrs. Kehinde Umeizudike, you're welcome, ma.
Thank you so much. Thanks for having me.
Yeah, on the left I have Dr. Mrs. Aderonke Dedeke. She's an oral health specialist, community oral health specialist. She's a dentist working with Lagos State University Teaching Hospital, Department of Dentistry. I hope I'm correct, ma'am.
College of Medicine.
College of Medicine.
College of Medicine,
Lagos.
University of Lagos. Thank you very much.
Thank you.
And this morning we'll be talking about oral health generally, in view of the World Oral Health Day that comes up on 20th of March this month. I know many of us may not know that the oral health, our mouth, is actually a window to our general health. From your mouth, a doctor can actually make a number of discoveries, can actually understand if you're having some chronic illnesses, not just looking at your teeth. And today, we have two experts in the house that will be telling us all we need to know about oral health generally. Oral health, the diseases affecting the teeth, the tooth, are one of the major non-communicable diseases we have in the world today. It's being said that half of the world's population are having one form of disease of oral health or the other. About 3.86 billion specifically, ranging from dental caries to periodontitis and a number of other disease conditions. And with us today to do justice to the topic is the two ladies that we have around. So I would like to use the floor at this time to you, ma. What is the oral health? What are we talking about? What do we need to know about World Oral Health Day? Thank you very much, ma.
Okay. Thank you so much for having us. Oral health can be defined simply as the freedom from chronic pain, from any functional disability or disorders that can affect any part of the oral cavity, and that limits the ability of the individual to carry out or perform their normal functions. And what are these functions? Functions such as chewing, speaking, swallowing, tasting. So any disease or any disorder that affects any of these functions, or even the ability to express their facial expressions emotionally, with confidence, that can be defined as oral health. And it's important, this definition means it's not just when people have pain. It means that anything that even starts, chronically, but does not even, is not yet manifesting with pain, means that there's a problem. Do you understand? That is why it's important for people to visit their dentist regularly for checkup. So that's how we can describe oral health. And the World Oral Health Day, which is marked on the 28th of March every year, particularly by the World Dental Federation, the FDI body, they have a theme this year which says, say ha, act on your mouth health. And what it means is that they want individuals to begin to take responsibility over their own health. They should not wait until there's a pain or there's any problem. They should use the initiative and avail themselves of opportunity to take care of their oral health by visiting their dentist regularly and other dental professionals. Thank you.
Thank you very much, ma. And I will turn to you, ma. Okay. Community oral health. What does it entail, ma?
Thank you for the question.
Thank you.
Excuse me. So community oral health actually entails the oral health of different communities. ideally, we should have information on different communities, let's say wards and local governments and states. We should be able to say within this community, this is what is prevalent amongst the community. If we say, hypothetically, in Mushin local government area, this is the prevalent oral health issue that is present there. So it is actually the oral health of the community on that community level.
Okay, so how do we apply it to our own local community here? I'm talking about Lagos State, for example.
Yes. So it's actually taking health down to the grassroots, to the councils, the wards, the local government areas, so that not everybody has to come to the tertiary institutions. So in Lagos State, if we have the office of the dental officer of health in court, the person's responsibility would be to get data of what are the problems, oral health problems within his or her jurisdiction, within that local government. And you do that by carrying out studies, going to the field, what we do call research. You go out there, you take a survey, you want to do oral health examination and find out what are the prevailing oral health issues within this community. Not just because we want to have data, but we also want to then put things in place, whether policy-wise, put things in place to ensure that we meet those problems and then we prevent those problems occurring in the future on a population scale, on a community scale, rather than individuals going to the clinics.
Thank you very much,
You're
ma'am.
welcome.
So I would like to know, what are the commonest or the common oral diseases that we have in this environment,
Okay.
as well as the impact on our society?
Well, the commonest diseases, oral diseases we have in our environment include dental caries, also known as tooth decay,
Okay.
and also periodontal diseases, also simply known as gum disease. There are other diseases that we have that are not as prevalent, but they are becoming more prevalent, things like oral cancer. We also have things like oral ulcers, and also others like trauma, for instance, to the tissues or structures of the face in form of road traffic accidents or injuries, which can cause fractures of the jaw and the bones. So these are some of the prevailing diseases. Now, tooth decay or dental caries affects both children and adults, but it's commoner in children and adolescents. But even now, it's becoming more common because of our diet, and the refined carbohydrates that most people, become exposed to with the changing lifestyle. And then periodontal disease is actually one disease that is prevalent. We have it affecting averagely about 9 out of every 10 individuals generally, and we're talking about 90-something%. But of course, we have the mild forms, the moderate forms, and the severe forms. So the mild form is the one that affects about 9 out of 10, and this is the one we refer to as gingivitis, which is just inflammation of the gum tissue. While the more severe form that affects not just the gum, no, it affects the bone that surrounds the tooth and the other ligaments. This is referred to as periodontitis. And these two diseases are the major cause, the impacts that they are the major cause or causes of tooth loss, not just in Nigeria, but even globally. And so it's important we put measures in place to actually prevent them, and when they even occur, to treat them early, because tooth loss affects the quality of life. That's one of their impact. They affect the quality of life. Remember the definition we said about oral health. Any disability, any disorder that can affect the ability of an individual to carry or perform their normal daily, functions, is a form of disease and should be treated appropriately.
Thank you very much. At this stage, I would like to open the phone line so that viewers at home and around the world will be able to put in their calls If you have any question to ask the doctors that will have with us today, ranging from how to take care of one's teeth to anything whatsoever, they are here to do justice. The numbers to call are displayed on our screen, okay? From where you're seated, I think you can see it. Those are the numbers to call. Okay, so I would like to ask you, how can a layman, because oftentimes we hear that one should brush his or her teeth twice in a day, morning and night. Are they all that we need to know about taking care of our teeth?
Thank you.
Thank you very much, ma.
Taking care of one's teeth, how brushing properly is one aspect, because what you eat is also important. Your habits, oral habits, are also important. But the major factor really is getting rid of that dirt, that plaque or calculus, if I use our own professional terms. Yes, getting rid of that is key. And to be able to get rid of it is in the brushing. When we say brush twice daily, we mean ideally last thing at night before you sleep. So meaning when you brush at night, you don't take anything. You can take water, ordinary water. When I say ordinary water, I mean it can be cold, but not fizzy drink. Yeah. So you take just water. And then ideally, if you can, you brush after breakfast in the morning. The reason behind brushing is to get rid of whatever food debris is left. It's not just for the freshness of breath. Yes, that comes in. But it's really to get rid of the food debris and the dirt that is there. Then in also taking care of your teeth, we can see some nice-looking gadgets in front of my boss. In also taking care of one's teeth, we also advocate flossing, using dental floss. The thing is, a lot of us use toothpicks. No.
And by so doing, we end up
damaging
the
structures,
injuries.
yes, that support the teeth. So we are supposed to floss. There are different forms of dental floss. There are some that are strings that you tie around your fingers, but there are some that have come. Yes.
I think we can.
Okay.
Yes.
Okay.
That is pre-packaged.
So how can we get this, ma?
Oh, it's in any available supermarket.
Okay.
Any standard supermarket, you will find dental floss. So for the regular person, your toothbrush, medium textured toothbrush, please. Not hard, not smoker's toothbrush, not soft. Medium textured toothbrush in a reputable supermarket, not by the roadside. If you go to the bus stop and you pick a toothbrush because it's written medium, no, not that sort. You go to a standard supermarket, you get a good toothbrush. I'm not advertising for anybody. So you get a good toothbrush, you get a fluoride containing toothpaste. Yes. There are enough of them out there. Just check the back to see if you see fluoride on it. You use that. All you need really, if I'm honest with you, is a peanut size portion of toothpaste. Not the whole length of the head of the toothbrush.
Like we usually do.
No. That's just advertisement. So that, and then you want to brush for at least 2 minutes, all the quadrants of your mouth. Then watch what you eat. The more sugar you take, the more damage you're doing to your teeth and your general health. Because bacteria in the mouth acts on this sugar and breaks it down into an acid. And we know the way acid acts on the body. It's similar to what it does to the teeth. It does this over time, and then you have this cavity, what we call dental caries. So really, there's a lot to it, but I think these are some of the high points.
Thank you very much, ma. I'm sure you want to demonstrate to us how we can effectively brush our teeth at home.
Yes. And while we're on that, it's important for people to be able to also identify the common forms, the symptoms of, for instance, gum disease. Okay. Because before we'll talk about this, but it's important. Okay. One of the earliest signs or symptoms of gum disease is gum bleeding, particularly while brushing. People think it's a normal part of brushing. Have that every morning, and they just spit out the saliva, toothpaste with blood. But that shows there's a problem already starting. And so you shouldn't just wave it aside. That means it's time to visit the dentist. Another common symptom is things like redness of the gum. They might notice then their gums become puffy, swollen, and also sometimes they could even present with bad breath. halitosis, food packing. Now, when it starts becoming more severe, when it becomes periodontitis. Then that means the bacteria in plaque, the plaque which is the main cause of this gum disease, is tracking down into the deeper tissues. And with time, it affects the ligaments and the bone. And when it affects the bone, it destroys the bone. And when it destroys the bone, what happens? The tooth will become mobile. Deep spaces, what we call pockets, begin to form in between the teeth. And where this happens, people complain of food packing. And they end up now having to use what she mentioned, Dr. Dedeke, toothpicks, to poke the gum, to damage the gum. And at the end of the day, it doesn't solve the problem. And with time, not just do you have tooth loose, becoming more mobile or loose. With time, it actually starts, maybe we use the word migrating. They start having uneven spaces.
Okay, I think we have Stella from Delta. Stella, good morning.
Good morning. Not Stella, this is Christiana.
Okay, Christiana, apologies, ma.
Yes.
Please go ahead.
Okay.
Do you have any question?
Yes, my question is it that dystonia, is it advisable for someone to do it by itself?
Maybe I should take that because I have one.
Okay.
Well, dystonia, just what she said, just means a space between the teeth. The common one is the midline diastema, like I have, the space between my teeth. In our environment, this part of the world is a thing of beauty. And so, but in some parts of the world, it's considered a kind of malocclusion, a problem with the dentition. But what we find, because many people desire this diastema, they go to quacks who now begin to file the teeth, and to create these artificial spaces. But
I think they call it open teeth or
open
something.
teeth. There are times we've had people saying their fiancé or their husbands wanted them to have this diastema and things like that. But the problem is that it would damage, to remove the enamel layer, which is protective of the teeth, and expose the dentin, which becomes, and what happens is that the person will start developing sensitivity. And sensitivity means the dentin has channels within. Through these channels, bacteria can track into the pulp, the inner part of the tooth, and cause infection, and maybe even tooth discoloration later on. So it's not something we advise for you to do. Just be happy with what God has given you, and I'm sure you'll be fine with that.
Okay, so back to the demonstration you wanted to do.
Now, there are different methods of brushing, different methods. We have the bars, the roll, but just for ease, we will demonstrate the roll technique. Now, let me first say, maybe we should say what is not the ideal way. What many people do, that's what many people do. But what happens, this will damage the teeth and the gum. So what we advise is that you place your bristle, the toothbrush bristle, on the gum.
Yes, you can see what you're demonstrating.
And then you make downward sweeping movements with the mouth slightly open.
Okay.
Downward sweeping movements away from the gum. You brush away from the gum. And if you can see, as I'm doing this, there's a rolling action on my wrist like this. So we call it the wrist roll technique. And when you are brushing, you must be systematic. You brush a group of teeth together at the same time, like that, maybe about 5-6 strokes. Then you move to the next set of teeth, like that, and you also brush the lower ones, the lower teeth. And then the inner surfaces, many people forget that, they neglect that. They focus on the part they can see. And sometimes the problem starts from the inner surfaces. So they also brush, away from the gum. That's the principle, like this. And then, of course, you must not forget to brush the grinding, biting surfaces of the teeth also. And then the tongue, gently. Now, apart from brushing, because if you notice, the bristles may not have access to the interdental spaces because of the size. That's where the dental floss is important, to remove plaque, not just meat or fish that gets stuck, and it should be done every day, once a day. Now, there are no spaces here, but essentially, you place the floss in between the teeth and adapt the thread-like part against the side of the tooth, gently, without a snapping.
So this can actually replace the toothpicks we usually have in restaurants.
Yes, Yes.
So it's not advisable that people should use toothpicks.
Well, it's not, but if they must, it's not. We prefer floss. Floss is better. It's the best option for interdental cleaning. But if you must even use toothpicks, like this has the toothpick end, it's plastic, you know, and then the shapes are different. Most of the toothpicks we have, they are circular, they are round body, the shape, and they could cause damage.
Sometimes very big.
They are very big, and they could damage the...
Lovett from Delta, good morning.
Good morning.
Yeah. Pleased to meet you. Go ahead with your question. Should there be any?
Okay. Please, I want to ask the doctor, is it proper to use this brush for a baby under 3 years?
Okay. A baby under 3. Now, yes, to answer that question, I would say once a baby starts erupting a tooth is when you start cleaning the tooth. Not with a brush. Unfortunately, I don't have what we can use. It's like a little rubber that you put on your finger. It has a tuft. You can use it to clean that tooth. Now, a baby under 3, you should have started brushing for that baby
6 months.
Yes. Because we have pediatric toothbrushes. The heads are smaller. So you handle that. From about 6 months, you can use it to brush. By 1 year, definitely. By the time the child is 2, you should have two toothbrushes in hand. One for the child, one for you. Because we know that at that age, they probably won't want you to brush for them. So both of you will be doing the brushing together. By 3, come on. By 3, the child should be used to you brushing his or her teeth. And for children, when I spoke earlier, I said we use a peanut size of toothpaste. That's for adults. For children, we just tend to use a smear, just so that there is something on it so that the child can taste it. Because we know that at that age, they tend to suck up everything and swallow. If you say spit out, it's difficult. They probably have swallowed most of it. So that's what you want to avoid. So a child of 3 years, definitely. From like 6 months, you should have tried to start introducing the pediatric toothbrush.
Okay, thank you very much. I have 2 questions in one, still along that line. Now, for children as well, is it advisable to allow them to make use of adult toothpaste? That's number 1. Number 2, what's the importance of fluoride? We usually hear dentists talk about fluoride containing toothpaste. And what are the other sources of fluoride? Okay, thank you very much, ma.
Okay, the first question, simply put, it's not advisable for children to use adult toothpaste.
Okay.
There are a couple of toothpastes that are for children. It has less fluoride in it. And that's because children inadvertently swallow some of this toothpaste. Unfortunately, again, I can't give you names, but there are reputable toothpaste companies that make pediatric toothpaste. So if you check any of your very good standard supermarkets, you should be able to find. If you don't get one and you have to use the adult toothpaste, you want to use very little as possible. Now, what is the role of fluoride? Now, dentists here advocate, in fact, dentists all around the world advocate that you should use fluoride-containing toothpaste. This is because fluoride has this kind of protective action on the tooth surface. It sort of delays or prevents caries from beginning. Now, even if you use, that is not to say that if you use a fluoride-containing toothpaste, you can then not have caries. Because there are other factors, especially your oral hygiene and then your diet. If all those factors are in place, meaning you eat properly, you clean as often as possible, the fluoride is supposed to have this, protective effect on...
And also strengthens the tooth, makes it more resistant to tooth decay. And I think that's important. And it's important to also know the kind of diet we are talking about, that we want to discourage refined carbohydrates, lots of sugar, like sweets, biscuits, cakes, chocolates, thank you, even soft drinks also. Because what happens is that when you take them, when they are taken frequently, that means they are always making substrates available for the
Microbial
bacteria.
activities.
Yes, microbial activities, and that would lead to more acidic environment persistently, and that can lead to demineralization of the tooth structure and cavity sets in. And
Sometimes I wonder why it's possible for cavities to develop, because we do know that the tooth is said to be the hardest part of the human body, even much stronger than the bone. How come we often develop cavity, even with all this?
well, it's because it's because of our lifestyle and diet. Even the strongest man.
Okay, sorry, I will stop you a little bit. Mary from Sokoto. Good morning, Mary.
Good morning.
Yeah. Please go ahead with your contribution, ma.
Yes, my contribution is that I say concerning the teeth, that for example, when you are brushing your teeth and you got showered, how are you going to take care of it?
Sorry?
No, we didn't get to. Can you take the question again, ma?
If you are at times you are brushing your teeth, you just look at your teeth in the shower, you cannot brush very well, you cannot eat something hard. So how can you do about it?
We still did not get to. Take it slowly. Thank you very much.
Okay. I said, for example now, concerning the teeth, if you are brushing, at times you look at you at the end of brushing, you're not able to eat hard things. Like maybe you want to eat meat, you cannot be able to eat it. So how are you going to go about it?
Okay, I think I got what she's saying. I think she's talking about sensitivity. So after brushing, you have these feelings that may not allow you to chew properly.
Okay.
Is that what you mean, ma? Okay, I think we lost that.
Okay.
So sensitivity, let's talk about that.
Okay. Well, if she's talking about tooth sensitivity, like from the last caller who mentioned about diastema,
Okay.
that would lead to exposure of the dentin. And this dentin is very sensitive. So once you have this dentin exposure, even taking ordinary water becomes a very difficult task. And so if there's sensitivity, the good thing is that it can be treated. But we first have to identify what is causing it. It could be, like I was demonstrating earlier, the brushing technique. There are people, many people, most people brush horizontally in a scrub manner. And what happens is that it will wear and expose, remove the protective enamel and expose the underlying dentin. And that will cause sensitivity. So they need to stop that habit. That's one. And then we can treat them by using desensitizing toothpaste and agents. They are available. And so we want to still use this avenue to encourage people to take their health in their own hands. And by doing that, the World Oral Health Day that is coming up next week, March 20th, is an important avenue for that. Well, we are from the University of Lagos, the Faculty of Dental Sciences, and the Lagos University Teaching Hospital. We are going to be having a program, a free dental screening program, oral health screening program, oral screening, and also free dental treatment on
for
that
all
day.
Nigerians.
For as many as avail themselves of the opportunity. And that will be at Luth, the dental center. So it's an opportunity.
I hope you have enough space to take us.
We are. Dr. Dedeke?
We're more than ready. We're able.
Thank you very much. I also would like to ask you, ma, how often should one see a dentist?
That's a good question. What we advocate and is advocated really that you should see your dentist regularly. But again, regularly we could say at least every 6 months.
Okay.
You should visit your dentist. But there are some people who need to come and visit regularly. That's more frequently, maybe every 3 months, every 2 months. But we say every 6 months because if there's anything any oral problem, it can be picked and detected early. The major reason why we have a tooth loss, in that with that high prevalence is because most people present late. Most people don't come to visit the dentist unless they have pain.
Issues.
Even when they have the pain, what they do is that they actually visit the chemist. They would have tried self-medication.
Just a minute, let me stop you a little.
Hello?
Yeah, love. Good morning, love. Yes, go ahead.
Yes. My question is that what can we use to any mouth that has odor?
Thank you very much. Thank you very much. I'm sure Dr. Dedeke will want to take the question.
Okay, so mouth odor, or what we call halitosis, could be caused by various things. But the commonest usually is poor oral hygiene, where you have a lot of dirt, a lot of plaque and calculus in your mouth. And also, if you have caries or you have, like what my boss talked about earlier, pockets where you have food packing between those pockets, if you don't remove whatever food is in between those or is in those pockets, of course, they begin to decay and then they begin to smell. Then, of course, there are more serious issues where you have halitosis, maybe like diabetes or, you know. And then also the foods you eat can also cause halitosis. If you eat garlic, if you take onions, and, you know, soon after eating and you come near somebody and say, hello, you know that is, you don't notice that people just, yeah. So it depends on the reason for the halitosis. But the commonest reason is poor oral hygiene. And to treat that is to, first of all, come to the dentist. Because then I'm sure that there's a lot of plaque and calculus that we need to mechanically remove. Your toothbrush cannot remove calculus. We have to use our hand instruments to remove calculus. And then if there are any pockets, we have to treat the pockets. We have to
just
fill
a minute.
the cavities.
AY from Ebonyi. AY, good morning.
Good morning, doctor.
Yeah, we are pleased to have you.
Yeah, I have a question for other doctors.
Please go ahead.
Okay, growing up, I always said that if you use black charcoal on your teeth, that it will make your teeth to be white. So how true is that? And I used to see some elderly women using snuff on their teeth as well. I don't know, maybe to clean their teeth. Is it healthy? And that of charcoal to wash our mouth, is it also healthy? And again, lastly, I want the doctor to please demonstrate the way we should be brushing our teeth again and to use that or that tooth.
Okay, thank you very much. Thank you very much for those 3-in-1 questions. Okay, I'm sure Doctor will want to take
Let
them.
me just deal with, well, interestingly, that's what we met. We were born into. That not only were they using charcoal, chewing stick, which are ash, they were also using china plates. We had those stories, they would grind them, you know. But again, that was before the advent, so to say, of...
also to add to that,
yes.
back in the days, we used to buy some powders from all those molue. When we used to have molue in Lagos, we'll tell you that once you use that powder, my dad used to buy them always, and he will make sure, he will ensure that all of us, he forces us to use them. Okay, so you add it, you dip your chewing stick and then use it to scrape, and usually it works. After you observe yourself in the mirror, you may discover that your teeth is a bit. So the use of all this.
I think really they have a kind of abrasive action. That's what they have. That's what's common to them. And something that has an abrasive, astringent action is likely to make your teeth brighter, whiter. But you know, oral health is not just about the teeth being whiter. There are people that also bleach their teeth and do a lot of things that could actually, which has its positive sides, but some do not do it properly, which could also damage even the gum and the surrounding tissues. And some of them do not have the benefits that we have in toothpaste, like the fluoride, you know, like the detergent action of toothpaste, even the anti-calculus agents in toothpaste. So in the long run, they might look like, okay, at least they keep the teeth whiter, but again, they could damage the teeth. You know, they could be...
Just a minute. Joshua from Lagos. Good morning, Mr. Joshua.
How are you, sir?
I'm fine, thank you.
Yeah, I'm happy watching the program.
Thank you, sir.
So are the doctor confirming that chewing stick, they are good, or are there special stick that is good for chewing stick? Because in the local area, they call some wood, some of them they call, some of them when you chew it's pepperish. Are they good for our teeth also?
Okay,
thank you very much. I'm sure you want to take that question.
I'm going to also take it along with the last person's question on the old women that are using snuff, because that would lead us to
tobacco.
Yes,
use of tobacco.
But let me answer Mr. Joshua's question. Using chewing stick, we will not tell you using chewing stick is bad, but I can tell you for sure that brushing with chewing stick is more difficult than using a toothbrush. Most of the time, people just chew this stick. I'm sure you have seen it. You've seen what they know, especially in the rural communities, where the person has a chewing stick in the mouth and is chewing and saying, and it's just chewing and saying, hey, Chinedu, how you dey? And it's just chewing. It's not really brushing. And when you're using...
We're hanging out on the corridor.
Yes, and when you're using a chewing stick, you have to brush each tooth. Every surface of that tooth, one at a time.
And again, it doesn't contain fluoride.
No, it doesn't contain fluoride. Even though there are some medicinal roots.
Okay.
There are some medicinal roots that do contain, yes. But because of the difficulty in brushing, but we know that we have the older generation, that it's going to be very difficult to say, switch from chewing stick to toothbrush.
Can both be combined?
Yes. As long as you chew the tufts of your chewing stick till it's about medium texture and then begin to clean each surface of the tooth. Trust me, it's not easy.
Yes.
But if you can do that without greeting Chinedu or greeting the Yarisika and facing your toothbrushing,
and that means you must spend at least about 3 minutes averagely to brush. It's not 20 seconds brushing. That will not get the job done. So people need to also know they have to allot about 1 to 3 minutes, or at least 2 to 3 minutes, to spend time on brushing. Morning and last thing at night. And maybe to also just chip this in, we've been talking about oral health. But like you rightly introduced, the mouth is the gateway to the body. Recent studies have shown and proven and documented that oral health diseases, particularly gum diseases, periodontitis and all that, can affect and worsen some systemic conditions like diabetes, like hypertension, like even stroke, and also things like pregnant women. It can be related, it's associated with low birth weight babies. So, and this is because of the chronic condition, the bacteria, they are there, they've been living there, existing, and they can enter into the bloodstream and cause this problem.
Pneumonia and what have you.
A lot. So it's important that people really pay attention to the oral health.
The use of tobacco. In the course of preparing for this presentation, I realized there's not just there's smokeless tobacco, okay, and then there's one that people smoke.
Yes.
And with alcohol, what risk do they pose to our oral health?
Thank you for the question.
Thank you, ma'am.
Smokeless tobacco, and you mentioned in our own environment, people use snuff, and some even take taba, and kind of sniff or snuff, and then some even put it, I think, in their, maybe in their mouth, their buccal cavity, and leave it there. But what it does is that it has a way, it's associated with cancer. It can predispose them to having precancerous lesions, not speaking big grammar, but cancer. Ultimately, it might not. It's not like everybody would develop that, but it puts them at risk of developing cancer. Beyond that, it also has been shown that smoking worsens, gum disease. So even when the place that's smokeless tobacco, they come in like powder form on the gum, they can cause gum recession and damage the support of the tooth. And so it's not something we advise. And we know the health risk of smoking generally, lung cancer, so many other cardiovascular disease. So it's something we discourage strongly. And
thank you very much. I would like to ask you, this will have to do with babies now. Okay, sometimes mothers give birth. Some may not be opportune to get to the hospital. They give birth to babies only to discover that there's some form of congenital malformation affecting the mouth. I'm talking about cleft lips and cleft palate. I would like you to say 1 or 2 things, because the number of children who may have been born with that, their parents may not even know what it is, so as to enable them go for corrective surgeries on a good time, and they oftentimes live with it. They become adults.
Yes, thank you. With cleft lip is when during embryogenesis, when the baby is forming, there are certain, sometimes the mother doesn't take her folic acid. Sometimes you don't even just know why. The baby doesn't form properly. So the mouth doesn't form as it should. There is this gap or a split of the lip. It is more commonly the upper lip, but it could be either the upper lip or the lower lip. And it may involve a palate, the roof of the mouth, yes. So sometimes you have just a cleft lip, sometimes you have it along with the palate. But the good thing is that it is treatable. Once you notice this, Luth has, in the dental center, we have the smile train, we have the oral surgery, oral and maxillofacial surgery department. They work on this. This is something they do on a regular basis. Yes. So if you're looking for the best care when it comes to cleft lip and palate for babies, even the adults, because sometimes you have adults who their parents for some reason didn't bring them, you can actually come, and because the earlier you do, the better, especially because a child will not be able to suckle. The child, if you put the child to the mother's breast, they can't suckle because, you know, you're supposed to, the mouth forms a seal. You can't create that pressure. So please, there is really nothing wrong with the child. The child is not an abami. Yes, because I hear this a lot in the community. Or banje, or something. No, it's just something that happens. The way I've turned out dark-skinned and my boss is light-skinned, yes, it's just something like that.
It's no fault of the
baby. It's no fault of the parents. Please. So
and it's correctable.
It's correctable. In fact, it's sometimes it's so beautifully done, you can hardly tell that something had happened.
I'm afraid this is where we'll have to stop. Viewers at home and around, I wish we had more time. Okay, so we all have an invitation extended to all of us to go to Luth, the dental department, on the 20th of March, 2019.
Wednesday from
8 a.m. to 3 p.m., I guess.
Yes.
Okay, so you have an opportunity to have a dental checkup if you've not gone for one since you were born. Because I know a lot of us have not even gone to see a dentist in their lifetime. So you have a lifetime opportunity if you're residing in Lagos. You can travel over. It is free. Okay, so I'd like to say a big thank you to the doctors that are with me on the program today. On the right, I have Dr. Kehinde Umeizudike, consultant periodontologist and associate professor, Department of Preventive Dentistry, University of Lagos. Doctor, you're welcome.
Thank you so much for having me.
And my oral community health specialist on the left, Dr. Aderonke Dedeke. Thank you for coming.
Thank you for having
me. I hope we'll be able to bring you back some other time. And to viewers at home, from all of us here, it is bye-bye. So we'll see you next week.
Bye.